on every other monthly basis. We'll get started. Today we'll be hearing from Assistant Chief Rodney Reed of the Harris County Fire Marshal's Office. Rodney Reed is Assistant Chief of Operational Support for the Harris County Fire Marshal's Office with over 15 years fire service and military experience. Assistant Chief Rodney Reed is a graduate of Texas A&M University with a Bachelor in Communication. Reed also holds a Master's of Science in Emergency Management Services. I'll turn it over to the Chief.
Afternoon, everybody. Just because I'm sure you all don't want to see my ugly face, I'm going to go ahead and just do the audio so y'all can see the slides. So I really appreciate the opportunity for EMAT to have this webinar with us. I serve as the backup. The current fire marshal for Harris County, Lori Christensen, is the primary on the NFPA 3000 committee, and I serve as her backup. So this is an interesting ride. It's definitely a conversation that needs to be had. Standards that need to be adopted, but again, it's not without everybody knowing a better way to do this. So, you know, NFPA 3000, this is a standard in which, you know, we can all start to get behind. It's not going to say that some jurisdictions are going to do things differently and some are going to add to and subtract from. But again, I think at the end of the day, if we can all start to standardize our response, I think we're going to make it better. So this is my first time doing a webinar, so this is going to be a little bit interesting. I don't have all the faces to determine whether or not I'm on track or I'm not on track. So hopefully y'all enjoy this, and like Francisco said, we'll make this available afterwards. So we're going to try to figure out why the slides won't move now. 1 second. All right, so attached you'll see this is active shooter incidents that have occurred between 2000 and 2017, put together by the Federal Bureau of Investigation. So what they saw was 250 incidents that met the minimum standard requirement for an active shooter incident, which resulted in over 2,000 casualties, almost 800 people killed, and 1,148 people wounded. And as you look at this map, one of the things, and I'm sure many of you from around the state of Texas can attest to, this is not just a big city problem. That was always the mentality was, hey, this is a big city problem. This isn't going to affect rural America. And what we have seen over the years is we've seen that, yes, we do have incidents that happen in our large metropolitan areas, but we also have incidents that happen outside of those in the unincorporated jurisdictions or more rural suburban communities throughout the state and throughout the nation. But again, the frequency of this is what is really starting to draw the attention. When the FBI analyzed the first 7 years of their data, they saw they were seeing about 6.4 active shooter incidents a year annually. And then as they got farther in, they saw it the last 7 years getting up to around 16 incidents annually. So again, seeing that increase really starts to drive home that need for us to come to a better resolution on managing these incidents. So looking a little more specific, looking at more recent times, we've seen between 2016 and 2017, as put out by the FBI, 50 incidents, 943 casualties, 221 individuals killed, not counting the assailant, and 722 wounded. And this really started to bring home this idea of, hey, it doesn't matter where you are in the United States. This is something that's going to affect you, and we really needed to start to figure out how do we move forward in this process. So the other thing that we start looking at when we're looking at active shooter incidents is we start looking at the locations. So as they looked at 220 active shooter incidents in the United States during 2000 and 2016, what the NFPA committee started to realize is, you know, we focus so heavily on the education, active shooters in school incidents, active threats in schools, that we start to forget that, you know, of the 220 that were analyzed, only 48 of those incidents, 21%, were in educational facilities versus the 43% seen in commerce, the 10% in government facilities, and then our open space environments like we saw in Las Vegas. So again, active shooter is again not a big city problem, and it's not just isolated to educational facilities. It is truly a global problem. So why did the NFPA get involved? This is kind of the question that I get most often as we're talking about this, because you hear NFPA, you start to think, well, what does the National Fire Protection have to do with active shooter? And what they found was after the Pulse nightclub, Chief Draws, Otto Draws with the Orange County Fire, who responded to the active shooter incident at the Pulse nightclub, realized like, hey, we need to go out and find some sort of consensus standard, some organization that can bring together all the relevant parties and actually create a standard that can echo across the United States. So obviously when Chief Draws went to NFPA, he says, hey, look, I get it, but this doesn't just need to be a fire department problem, right? We have to reach out. We have to include our EMS professionals. We need to include our law enforcement, emergency management, public works, nonprofit. We need to start engaging all of these partners to come into this. We need to make sure the fire marshal's involved so that when we're putting these standards, we're not going against things that are already existing in NFPA standards, and then also looking at it from a code standpoint. So what happened was Chief Draws brought the problem, and NFPA said, hey, look, we're going to take a look at this. NFPA said, you know what, we're going to form a new technical committee. And that new technical committee was the Cross-Functional Emergency Preparedness and Response Committee, which was to be chartered to develop the NFPA 3000 document. So they went into they identified the problem, then they went out for a 3-month public comment from October of 2016 until January of 2017. And in that time period, they were seeking input. Do you believe that there is a need for this standard to be created? And overwhelming, they received over 100 comments. 97% of them was saying, hey, look, this is needs to be created. So then the committee moved forward into actually putting together the formation of the technical committee. So what was really interesting about this was that this was the second time a provisional consensus standard was being created by the NFPA. And what they saw over 103 applicants for this technical committee, which is the most they've ever had. So once they formed their technical committee, and we'll talk about on the next slide who was a part of that, they started looking at their creation. So they wanted to create this formal, balanced and broad technical committee. You needed to have folks from the federal level, the state level, the local level, looking at it from an industry standard, all those things that have made NFPA, right, wrong, or indifferent, the recognized standard that many of us in our business follow. Once they had their creation, then they moved forward and they started reviewing active shooter incidents and issues that had been put together. They started forming these, modeling a standard, and then had their provisional creation, which has now become the NFPA 3000 standard for an active shooter hostile event response program in the 2018 version. Now, right now, the second draft is being reviewed for 2021. Actually, I'll be headed out to San Diego on the 24th to review the public comments that closed back in June. So, again, if this is a passion of yours, I'd highly encourage you to pay attention on their website for public comment. So again, the 55-person technical committee that was put together represented law enforcement, EMS, emergency management, facilities, healthcare, higher education, private security. And what we really saw was a lot of large organizations get behind this. The International Association of Chiefs of Police, International Association of Firefighters, International Association of Emergency Managers, these large organizations putting their weight behind the NFPA, saying, hey, look, it's time for us to move forward and set one standard. Because again, they started looking, a lot of people were in various stages of development, and it created some problems because it wasn't a unified response, which 3000 hoped to build. So NFPA 3000 is built on 4 primary components, right? The very first one is a whole community. You know, a lot of times, depending upon the public safety sector that you live in, many times we get very focused on our individual piece. EMS, hey, we need to, stop the dying. Law enforcement, we need to stop the homicide. This truly is a whole community where it starts in preparedness, and then God forbid it happens, it gets us through that recovery piece. And so again, NFPA 3000 looks at ways not only that we public safety prepare ourselves, but also how we engage our community to be active participants in the solution and in the early notification and all those other aspects. Then it moved into unified command. And this has been a really fun topic, trying to manage this specifically in Harris County. When we looked at that unified command, the NFPA 3000 committee truly saw the need that this cannot be a singular public safety entity managing this incident, because then only their objectives would be addressed. It had to move into this third component, which is that integrated response. How do we not only bring fire, EMS, and law enforcement together on the incident? How do we bring in our emergency management personnel to help us on the front side? How do we bring in our fire marshals to make sure that, what we've seen here in Harris County was, schools wanting to, hey, we want to not do fire drills because we want to do active shooter drills. Well, hold on. We haven't had a death in a school by fire since 1954. So let's don't throw out the stuff that's been working for us. Let's figure out how we can go into these higher education and at the state level and start to put together standards in which we're not just trading one emergency for the other. And then that planned recovery. How do we make sure that our response partners and into our public health and all those different aspects that we're going to need to recover from, that again many people just don't think about. They think about, you folks in emergency management are very, very keen at understanding that recovery piece, versus emergency response typically is only blinded to, hey, let's make the problem go away. It's not, how much longer is it going to take us to get back to that normalcy or that new normalcy within the area. So again, these are the 4 primary components that are going to guide the chapters of NFPA 3000. So again, having that single set of requirements for that whole community approach and that integrated response is critical. So a quick little bit of a diversion from NFPA 3000, because a lot of times what we've seen is a lot of people, they don't quite see the need for this. And so we injected some of these lessons learned from some active shooter incidents in the past. So looking at Pulse nightclub, each one of these AAR comments we're going to go through are AAR comments that are generated from the law enforcement after action reviews commissioned after the incident occurred. So in Pulse, you had 102 personnel that were shot, 49 killed, 53 injuries, and then over 300 officers responded to this incident. And what they saw was, Orlando recognized we have to have a better way of managing the self-deployment of the 300 officers, not only at the incident site, but also managing that citywide. Their uncoordinated self-deployment placed some officers' life in danger. Looking at evidence from multi-site attacks such as Paris and Mumbai and the attacks in the UK in 2017, you have to be prepared not only to deploy your resources to that incident site, but you also have to be prepared for multiple incidents, where we get into the complex coordinated terrorist attack type environments. Again, looking at preventing the uncoordinated and inefficient self-deployment of officers to the incident, making sure we maintain that critical piece, which is accountability, and making sure we don't have blue-on-blue incidents. Additional personnel should be directed to staging areas. NFPA 3000 is going to talk about how we manage this integrated response. Much like y'all probably have in your response jurisdictions. In Harris County, we may have just multitude of law enforcement agencies that are responding to a single incident, and it's getting ahead of that and managing that through appropriate staging. Again, back to the self-deployment, creating those officer safety challenges, and then directing people to staging areas to manage ingress and egress, right? That's another big part, is in that integrated responses. Once we have either isolated the threat or we've neutralized the threat, how do we start moving into the stop the bleed, stop the die? And then one of the probably the most important ones out of the Pulse was, as soon as possible and practical, is establishing a unified command of all primary first responders. Shifting gears now, moving out west to San Bernardino. Again, a little bit of a different type incident where it stretched over multiple locations. 36 shot, 14 killed, 22 injured, and over 175 officers responding. Straight from their words, agencies must continually plan to evaluate ingress and egress routes during those critical incidents. Again, as we look at this from a unified response standpoint, how do we work together? How do we make sure no single agency's objectives are being addressed, but everybody's objectives are being considered? And so we're not just worried about neutralizing threat. Traffic congestion from abandoned vehicles made it difficult for EMS to transport. And again, back to, as soon as possible and practical, during incident, establish unified command. And then designating staging area manager is critical. As many of y'all have seen, as described in a variety of NIMS courses, having that staging area manager is going to help us manage accountability and make sure that we're not overloading the incident location, and we're controlling that. Shifting gears now to out to Aurora, Colorado, the shooting there. 70 shot, 12 killed, 58 injured, and over 160 officers. And when we teach a version of this class to some of our law enforcement partners, one of the things I like to draw attention, this is the AVL data, the vehicle location data from the actual shooting. The call came in at 39 minutes after midnight. Within 2 minutes, there were six law enforcement vehicles on scene. 30 seconds later, an additional 4. A minute later, another 4, and so on and so forth. So by the time we're 14 minutes into this incident, there's already 55 vehicles on scene. That becomes a nightmare to try to manage that, especially if all of those response assets, although driven by a similar mentality, are operating as those free radicals, and they're not integrating, as we see as we move to some of their after action comments. Again, unified command was not established until late in the first hour. This would have resolved some communication issues, specifically around the transporting of people and the need for EMS up at the actual theater location, so that law enforcement could start extracting and getting them to the location. Again, back to same thing, keeping the paths open for ambulances, staging those mutual aid forces when their help is not needed, right? Again, everybody wants to. We all got in this business to help people, but there comes a point where we will overload our incident instead of, and then that creates its own challenges to manage. So again, looking at these, the 4 big topics you see is number 1, a lack of accountability, poor communication, lack of that systematic planning, and then that no management structure, which is what NFPA 3000 starts to address for us. Now, again, 3000 is going to guide us as we're going to get into these next chapters. But again, what I want you to think about is when we look at all these active shooter incidents, what's really changed since as far back as Virginia Tech? And I will tell you that for the most part, the only thing that's changed is the agency who's on the front cover of the after action review. Again, we're repeating the same thing, which is what 3000 is going to hope to overcome. And by engaging organizations like you in emergency management and bringing the power of the planning aspects, I really think we're going to be able to overcome this. So here's our roadmap for 3000. It's broken down into three chunks of chapters. Chapters 4 through 10, these are our plans. This is our plan development, how we develop our process, how we do our risk assessments, resource management, incident management, financial management. Then we move into the sexier piece where you get all the gun toters and the bandage holders and the hose draggers like myself to the table. And that's going through chapters 8 through 7. That's the response side. And then back engaging all of our partners, including our hospitals, bringing in the recovery side with chapters 18, 19, and 20. So again, the committee really sought to try to make this in the cleanest way we possibly could. So when you look at the program development, just pulling some highlights from each of these chapters, what it says is its purpose is to provide the authority having jurisdiction and stakeholders a framework for developing the active shooter hostile event response program. And the reason this isn't just active shooter is because, again, it can be there. The committee felt very a lot of passion to make sure we don't just focus on the use of a weapon in one of these incidents. Knife, vehicles, fire, there's a whole host of weapons that can be used. So in this, what it says is, and again, for those of y'all who are familiar with NFPA, there are shalls, which is very strong recommendations, and then there are shoulds. Again, though, the key to remember about anything NFPA is if your jurisdiction has not adopted NFPA as the standard, then, you know, you kind of make that choice of, if it's a national standard, what hazards are created by me not either meeting or exceeding it through my own program. So this said that a jurisdiction shall maintain a policy that establishes the following: that the ASHER program exists, what services are going to be provided, who are the program stakeholders, and what is the function that each stakeholder is expected to perform. And then that is all that information then becomes, the formation of that plan becomes drawn out in a step-by-step walking chapter 5 all the way through chapter 20. So again, chapter 5 starts to look at the assessment, right? Because again, as we look to build a plan, right, we have to do assessment. We have to figure what's our low-hanging fruit, which is our versus what can we get to later. So what it said is the very first thing you need to do is identify threats. What are targets or your at-risk locations? And then start thinking about items that need to be considered about them. Are they open air? What hazards are associated with open air threats? You know, one of the things that we were doing, having a discussion about is in open air, the use of drones, right? And then that movie just came out going after the president with little drone bombs, right? So again, they're going to be creative. We can't limit our imagination. We also then have to look at the resources, identifying all those resources. If you're in a municipality, that's very simple to identify your resources. But what happens when you are a county where you're sitting there trying to understand all the resources that would relate into an ASHER type event? And then the next step is establishing those relationships, what I'm sure many of you have already done. Then you need to start analyzing the consequences. What is the realistic expectations for a worst case scenario at those targeted identified locations that you did in the first step? And then finally moving into, all right, what happens if we have this worst case scenario, which for many of us, a large ASHER incident is very quickly going to overwhelm a jurisdiction. So now it's taking that next step and saying, okay, what happens if this thing cascades and one event goes to another? And now how am I going to managing this rapidly expanding incident or incidents within my jurisdiction? Chapter 8 identifies unified command. Again, for many of you in emergency management, this is nothing new. It's putting together all of the appropriate response agencies to say, hey, look, somebody has to do that initial incident size up. Somebody has to establish command, right? One of the problems we have specifically in ASHER type incidents is that law enforcement is typically going to be the first on scene. Well, they're judged by 3 things at the start of one of these incidents: their speed, their tenacity, and their accuracy. And what we have to do is start to build an environment that says at some point there's enough people going in to neutralize the threat. Somebody has to start managing the chaos from the outside. And that's where Chapter 8 comes in. Starts talking about how you establish unified command, how we transfer command throughout the duration of the incident, and then starts talking about tactical decisions, incident stabilization, all those different aspects that are going to come to play throughout the life cycle of one of these large-scale incidents. Then Chapter 6 starts to look at facility readiness. This is bringing in our stakeholders. That starts to set minimum requirements for the design, operation, and maintenance of buildings, occupancies for safety to life from an active shooter, right? This is truly going out and making this that whole community resolution rather than a public safety problem. Again, the NFPA, obviously, if your jurisdiction is an NFPA driven from your code standpoint, they started looking at the annex as being required in NFPA 101, the life safety code, and then also they will be putting in the next update of NFPA 101 that it will be drilled annually. So those of you who have adopted NFPA, that's that, and I imagine that the International Fire Code will follow around very shortly after it comes out of 101. And then it also started to outline the requirement for notifications or exercises, right? This is where the fire marshal's offices were very heavily engaged, making sure that you put in warning systems, they don't confuse them with the fire alarm. How do you start to engage those building owners to do these annual exercises? What should they look like? Who they should be engaging? And then the different portions of each structure that should be tested, right? We don't need to just test the one piece. We have to test all aspects of the Asher plan. Chapter 12 moves into responder competencies, right? So this is looking at providing law enforcement officers who in the course of their duties may encounter an Asher incident with the knowledge and skills to respond effectively and efficiently in an integrated manner. So programs like Alert have done an amazing job of training our law enforcement in Alert 1 and Alert 2 to go in and start neutralizing the threat. But what we've also started to see, Alert, and there's many other organizations other than Alert, just Alert comes to mind. They're getting into the AIR classes, the active attacker integrated response, because it's bringing in those knowledge and competencies that law enforcement needs to have, intertwining them with federal, state, local, and then also starting to look at that threat-based medical care. Because again, depending upon where you are in the nation or in the state of Texas, your first arriving law enforcement officers may be required not only to neutralize the threat, but then very quickly transition into stopping the bleeding and stopping the dying. So it's starting to set those standards. And then the other thing, and it's really funny, our law enforcement professionals really started to question this, was Al-Qaeda had put out a magazine, their Inspire magazine, that talks about fire as a weapon. So in NFPA 3000 talks about what happens if I need to go neutralize threats in an IDLH in a fire environment. And so it starts talking about that. That's a very interesting thing to try to manage. I'm not sure how that's going to be tested, but we'll see. I'm sure somebody's coming up with it. The next one it talks about is bringing our fire and EMS personnel so that if they would encounter, how do they start thinking about tasks by zones? And they stole the zones from NFPA 472, which looks at cold, warm, and hot. And so what are the actions that can be taken instead of fire and EMS just staging until law enforcement says that, hey, you're cleared to come up? Start thinking about, okay, well, we're staging. Instead of staging being a singular point, a geographic point, what can be happening in this cold zone that is mutually supporting actions occurring in the warm and hot zone? But again, those are all based on that unified response and coordination, which is that integration with our law enforcement, and then starting to look at competencies based on multiple aspects: shooter competencies, incidents involving vehicles, incident involving explosive devices. As we start looking back to the abortion clinic bombings, how we started to see the trend change, where they were not only at the clinic, but they were also in the bushes to get our first responder community. And then obviously what happens if we have a fire that occurs. So I call out in the PPE section, there's a lot of considerations for PPE when it comes from not only body armor, but respiratory protection, lots of other things like that. But, you know, a lot of one that comes is, you know, does fire and EMS need to wear body armor in warm and hot zones? That is probably one of the highest comment that was made during the last update. And so what NFPA's, this was NFPA's response to them, is that it means that if you are in zones where you need to wear a vest, you should be wearing a vest. But the committee understands that the cost of body armor is very expensive, right? You're potentially up to $1,000. NIJ only allows it to be certified for 5 years. So not only do you have the initial capital startup, you also have a every 5-year sustainment program that's got to be built in. So what they said is there's a provision in this standard that empowers the incident commander to send personnel into zones without vests for the purpose of saving a life, but it will need to be investigated and reported in the after action. And again, it just goes back to, we're going to risk a lot to save a lot. We're going to risk little to save little. So again, we've seen our fire and EMS come out and waive NFPA 3000 that, hey, we got to have body armor, you know, but there's a lot of things that the jurisdiction needs to consider whenever we're looking at this. The next piece is our public information. Chapter 17, it sets those minimum requirements for how to disseminate information to the public as part of the JIC, or the Joint Information Center, and the Joint Information System, right? It really hits heavily on the means such as social media, you know, stating it needs to be monitored as much as possible, which I'm sure many of you are already doing. And then how do we go direct to the public, right? And that's that mass notification system. So again, how do we take all the different methods that people are currently ingesting in their communication mediums, and then standardize that across the authority having jurisdiction? And then as we move into chapter 19, this was really starting to look at the hospitals from how are we communicating with our hospitals? You know, how are we making sure that we're having a systematic approach for them to receive patients? You know, one of the after actions from the Vegas shooting was, you know, again, all you're doing, you took the incident, you took the disaster that was occurring at the incident site, and you're moving that disaster over to the hospital. And so again, you know, this is where having our EMS professionals involved in these conversations, you know, they're very conscious on, okay, what hospitals are on divert? What hospitals do I need to move people to? And so again, involving the hospitals in that communication. Then it gets deeper into victim identification. Again, you know, the standard triage tags that we've built our lives behind in the documentation and the following that patient from the incident site all the way through. You know, we've seen in these large scale active attack incidents that doesn't always happen. So how do you engage the hospitals to make sure they're communicating back into emergency management, which is then being communicated by your family reception centers, things like that? How are we going to manage that victim identification? Facility security, looking at the security associated with the facility, so that, you know, we're if you start looking at things like the introduction of hazardous materials into these incidents, you know, how are we maintaining the integrity of the facility? We're not making a facility go black. How are we managing all those things, and then that recovery integration into the incident? So the other thing it does talk about is hospital emergency action plans. And what it says is what they don't have is a plan for receiving of patients from an event not at their facility. And the committee felt it very strong that there needed to be a plan out there for how to do that. How do I, you know, the EAPs are focused much on the hospitals, but how do they look at receiving whenever they're going to transfer that disaster? Then we get into the three phases of the recovery process. Again, for a variety of jurisdictions that may not be thinking about this part, they're still very much in the early infancy of their plan development. It's making sure we don't forget about that immediate recovery that has to happen, then the early recovery, and then moving into that continued recovery as you try to build your organization into some level of normalcy. So again, really looking at this thing from a whole standard. So again, each chapter goes into this a much deeper dive. Again, it is code language though, so some of it is left up to interpretation. Some of it will get you upset, but again, that's why you know, the NFPA does their periodic reviews and their public comment periods. But when we look at this, remember this, that what NFPA 3000 is trying to do, and again, this consensus standard was put together very fast. The committee is aware that there's holes and gaps, and there's things that say, oh, well, why are you putting this on me? Remember, they're trying to develop a multi-agency roadmap that applies to a jurisdiction the size of the city of Houston, to our El Paso, all the way out to Paris, Texas, right? How do I take something that can give everybody at least a roadmap to move forward in the development of this? They also wanted it to be unbiased, an unbiased document that was open to cross-functional communications. Again, the realization in today's society is the world of incident command, where you only have a single stakeholder with a single set of objectives, is more or less gone, right? We are now truly in a world where unified command, integration up to your emergency operations centers is so critical. And that's why, again, this document didn't lean heavy to one side of the public safety spectrum. It truly tried to take the middle of the road approach. Then it also looked at really how do we engage the emergency management. You know, as we look at our response agencies, specifically here in Harris County, what we've seen is law enforcement is great at developing, this is how we're going to respond to an active shooter fire. This is how we're going to respond. But nobody kind of saying, hey, are your policies, are your plans mutually supportive? And that's where NFPA 3000 said, hey, look, let's engage emergency management. They are by nature Sweden, right? So let's bring them, let's bring all the people to the table, and then we can actually start to make sure that all these policies and these programs are interconnected and mutually supportive. And then what they looked at is truly to become a tool to overcome what I like to call PPE, which is personalities, politics, and egos, right? You now, as an emergency management, or in your current profession, whether it be in public safety or whether it be in private industry, you now have a document to sit down around a table and say, hey, look, guys, here's a consensus standard made up of federal, state, local, and private entities that have come together and given us at least a guideline to start with. We don't have to eat everything that's in this book, but at least allows us to overcome the, well, an active shooter, an active attack incident is a law enforcement incident. It is, but there's a whole lot more to it. So let's figure out how we can work together. And so again, it really gives us that playbook to move forward. So